Hello, I'm Dr. Lourdes Del Rosso, and today I want you to learn about this amazing opportunity, the World Sleep Academy. The World Sleep Academy is an initiative of the World Sleep Society. The goal of the World Sleep Academy is to bring education about sleep and sleep disorders to all over the world. We are planning to start on September 1st of this year. And what makes this academy unique in comparison with other training programs? Well, this academy has been designed exclusively with the purpose of reaching everywhere, global reach and emphasis on sleep practice, specifically in developing countries. We are going to be delivering the courses over 1 year with 16 instructional units. Who should apply? Well, anyone who is involved in patient care. So if you are a practitioner, a physician, a psychologist, or you are a community health worker, public health, and you deal with patients that may present with a sleep disorder or have already talked to you about problems sleeping, and you want to learn more about sleep medicine, then this is the place for you. We have a large team of sleep experts from all over the world that have been working really hard for the past year to plan the structure of the academy, the modules. How are we going to deliver the course? We also have a group of people that are developing these modules, your teaching materials. We have faculty that are going to be delivering the lectures. And we have senior reviewers that are going to be being sure in ensuring that all our materials are the top of the top knowledge about sleep medicine. The goals are to grow in the knowledge of sleep medicine, starting with the basic knowledge at the bottom, recognizing sleep disorders, and growing to identifying and understanding the pathophysiology, perform sleep testing, analyzing the data and knowing how to read research publications about sleep and how to develop a sleep program. We have a diverse modules that include all the main areas of sleep medicine, from the basic science of sleep to how to build your own sleep lab. As you can see, you will learn how to identify, treat the most common sleep disorders in sleep medicine. This course or academy is divided in 3 tiers. You can register in all tiers and complete your program in 1 year, or you can register in each tier and learn the areas that are covered. For example, in tier 1, we're going to be giving the basic of sleep and sleep technology, like what are the neurotransmitters of sleep, why do we sleep, what are the sleep stages, how do we do a sleep study, how do we evaluate patients, and what are the basics of sleep study reading. If you already know this basic tier 1, you can start in tier 2. Tier 1 will last approximately 3 months, and then tier 2 will last for 6 months. And this is going to be the main meat of all the sleep disorders, the main bulk of knowledge about sleep medicine, diagnosis, treatment. As you can see in the topics of tier 2, you're going to see hypersomnia, insomnia, parasomnia, psychology, circadian rhythms, pediatric sleep concerns, and obstructive sleep apnea, and sleep disorder breathing, non-obstructive. We have a step forward, which are the last 3 months of your academic year. And those last 3 months, we're going to dig a little deeper into the knowledge of pharmacology, how to set up a sleep lab, advanced, more difficult case studies mentored by a sleep expert, introduction to research, leadership skills, and advanced sleep study and interpretation. So this whole program will last 1 year, and each tier 1 and tier 3 are 3 months each, and tier 2 will be 6 months. You can enter at each of the tiers, or you can start at the beginning and complete your whole program. What are the requirements for each tier? Well, to start in tier 1, to start the program, you have to have either a college degree one of those, either a college degree, just an associate degree, or above in either medicine, psychology, or a health-related science, or have held a leadership position for at least 2 years in a community health center with direct patient involvement. Starting in tier 2 with those requirements, in tier 1 with those requirements, you immediately can go to the whole program. But if you want to skip tier 1 and start in tier 2, you will need to have either a completion of tier 1 or a diploma course in sleep medicine, or at least 120 hours of experience in a sleep center, which will require a letter, or 60 cumulative hours of participation in sleep-related conferences. So if you have joined the World Sleep Medicine Congress, and you have 60 credits from joining the Congress, then you can join directly in tier 2. For tier 3, you have to have successful completion of tier 2, or completion of a fellowship in sleep medicine in your own country, or at least 3 years practicing sleep medicine under your own specialty, or completion of a master's level program course that lasts at least a year long. What will each unit look like? Well, each of those units, each of those subjects will have a manuscript that will provide you the necessary basic sleep knowledge. This is what we have been writing. We have prepared this for you, and you will actually just get this manuscript. An enrichment lecture from a sleep specialist, case study with discussion, and additional materials. So you will have several layers of learning to consolidate your knowledge about sleep medicine. You will have a text guide, you will have a lecture, self-guided video learnings, discussion boards, case studies, guest lecturers, and an assessment. So you can be sure that you understand the material. So you will be involved and registered in this course, which is remotely. So you will be logging in via Zoom. We will be giving one live lecture a week, and you will have access to some self-guided learning, case studies on your own, which you can do on your own time for the rest of that week. The workload is not heavy. You can work full-time. You can either be a full-time worker or student, and you can still do this program. Each unit will have 2 or 3 weeks to complete, but during each week, you will be responsible to attend one lecture. If you miss the lecture will be recorded, and you will be responsible to do the rest of the topics, either the video learning, the discussion board, or the case study, to complete that unit on your own. We will also have faculty and I myself and some support staff to help you through if you have questions or if you want to discuss anything. As I mentioned, you will receive a text guide. This is an example. Sometimes it's between 20 or 40 pages for each of the topics, and that will be your text guide that will give you all the information necessary, and you can start reading before your lecture so you can get the most out of the lecture, the most out of the cases and the discussion board. You will also be able to meet other colleagues. You will be able to meet people from all over the world. You build teams, collaborations, and meet sleep doctors and experts from other areas. The team, the leadership team of the World Sleep Academy, I am on the top, Lourdes Del Rosso. I am the director of the academy, the medical director, and we have directors for academic, which is Mike and Lindsay, who you can reach to us with any questions or any comments about the academy or your. I hope that this is of interest to you and that you take advantage of this amazing opportunity to learn about sleep medicine, to join the World Sleep Society, to grow in the knowledge of sleep medicine and become a world leader in sleep medicine for future generations. I'm really looking forward to meeting you and to seeing you on September 1st that we start. Thank you.